Hello, welcome back to the channel. You're watching the voice of Mzansi, and I hope you're ready for another important update from home. If this is your first time here, please make sure you subscribe and hit the notification bell so you never miss a beat. Now, this one has the whole country talking again. It's about our public healthcare system and how it's being used. Minister of Health Motsoaledi has revealed something that's raised a lot of eyebrows. The Department of Health does not keep records of either documented or undocumented foreigners receiving healthcare in South Africa. Let that sink in. No records. No distinction. Just open access. Please stick around until the end of the video to hear the sources where this came from and try to verify the news for yourself. So let's unpack this. Minister Motsoaledi, who returned to the cabinet earlier this year, made the admission during a recent parliamentary response. When asked how many foreign nationals, both legal and illegal, have accessed public health services in South Africa, the minister said bluntly that the department simply doesn't record that information. In other words, when someone walks into a public hospital or clinic, they're treated based on their medical needs, not their passport or visa status. Now, on paper, that sounds humane and constitutional. South Africa's laws don't allow for emergency healthcare to be denied based on nationality or immigration status. But the bigger concern here is, how can the country plan or budget properly if there's no data? How do you make decisions around healthcare spending if you don't even know who's using the services? Motsoaledi's statement stirred immediate reaction from MPs, healthcare workers, and the general public. Many are wondering how this has gone unnoticed for so long, especially with the ongoing strain in the public health system. We've heard over the years about overcrowded hospitals, long queues, medicine shortages, and burnt-out nurses. And now we're being told that the state isn't even keeping track of who's being served. In his explanation, the minister said the department doesn't distinguish between citizens and foreign nationals because the constitution guarantees health care for everyone in the country, especially in emergency situations. He did acknowledge that migrants do access health care, particularly in provinces like Gauteng, Limpopo, and Mpumalanga, but emphasized again that there is no system currently in place to monitor how many or what kind. According to him, the current hospital record simply lists patients based on their names, ages, and conditions, without checking IDs, visas, or asylum documents. And even where foreigners do present papers, that data isn't separated out in the reports the department uses. So at the end of the day, we just don't know. And this is where things start to get serious. Critics of the government say this lack of information could be one of the reasons our hospitals are struggling so much. Without knowing who is using services and where they're coming from, how can you even start planning for resources? One health analyst pointed out that it's like running a restaurant but not checking who's walking through the door or how many people you're feeding each day. Eventually, you're going to run out of stock. To be clear, this isn't about blaming foreign nationals. Nobody's saying people don't deserve health care. But when government itself is unable to tell us how many people it's serving, and whether they're citizens or not, it becomes a governance issue, not a moral one. South Africans are paying taxes that fund these hospitals. Surely, we deserve to know where that money is going and who it's helping. Motsoaledi did say the department is working on ways to improve data collection in the future, especially as migration continues to affect service delivery. But for now, we are still operating in the dark. Provinces like Limpopo have long complained about pressure from cross-border patients coming in from Zimbabwe and Mozambique, particularly pregnant women and trauma cases. Yet, without solid numbers, these claims remain anecdotal and hard to act on. Meanwhile, health workers on the ground say they're caught in the middle. They often treat patients who can't communicate properly, don't have ID, and sometimes even give false details just to get help. And with no official tracking system, it's impossible to manage the workload or push back when things become overwhelming. Now, let's talk numbers. South Africa's public healthcare sector serves nearly 80% of the population. That's over 45 million people depending on government facilities. Add undocumented migrants and asylum seekers to that, and it's clear the system is under enormous pressure. The sad part is, no one can tell us just how much of that pressure is coming from untracked usage. Some members of parliament are now calling for urgent reforms. They say it's unacceptable that the country has no way of measuring one of the biggest factors impacting healthcare. Others are warning that if nothing is done, the system could collapse completely, especially in border provinces. They want immigration services, home affairs, and health to start working more closely and sharing data. Of course, others are reminding everyone that human rights come first. Healthcare is a basic right, and denying it based on nationality could lead to legal challenges and serious backlash. But surely, there's a way to track users without violating rights. Just recording whether someone is a citizen or not doesn't mean you're kicking them out. It just means you're planning better. As it stands now, the department is making decisions about staffing, medication, equipment, and budgeting based on incomplete information. And as any accountant will tell you, that's a dangerous game. Without data, you're guessing. And when you guess wrong in healthcare, people's lives are affected. Motsoaledi's statement has opened a new chapter in the ongoing conversation about foreign nationals and public services in South Africa. It's a tough subject, and emotions run high on both sides. But at the very least, we should be able to agree that data matters. You can't fix what you don't measure. And right now, it looks like we're flying blind. So next time you're sitting in that long clinic queue, wondering why it's taking so long, just remember, the system doesn't even know how many people it's serving. It's like trying to run a taxi rank without counting passengers. Eventually, the wheels will fall off. All images used in this video are for illustration purposes only. Sources for this news include Parliament's official records, News 24, Times Live, Vovo News on Facebook, and SABC News. Thank you for watching. Please don't forget to subscribe and share this with your friends and family. Until next time, take care and stay informed.